back to DASy 2020 for our next session talking about managing failing and thrombosed dialysis access.
I'm going to talk about this ultrasound-guided intervention for the AVG dysfunction. Please, Dr. Haruguchi, please start your talk.
Ultrasound-guided PTA. I'm Hiroaki Haruguchi from Haruguchi Vascular Access Clinic. The background: in recent years, the PTA for vascular access has been dramatically spread. We had advanced in ultrasound devices and technology. Risk of X-ray exposure. Risk for the patients with residual kidney function. Risk of side effects of the contrast aid. Ultrasound-guided PTA in a clinic. We started PTA under ultrasound from August 2008. PTA is performed without fluoroscopy. PTA is performed using fluoroscopy in the central vein. Currently, more than 95% of the patients undergo PTA under ultrasound-guided. Ultrasound-guided PTA is also useful for the postoperative. With a linear probe, we use this right side of the linear probe. It is a 12 megahertz. Preparation of the ultrasound-guided PTA, and we use a sterile jelly in the echo jelly tray. This is a probe cover and rubber band, and this is a CM cover. This is a cover over the ultrasound device. This is the position of the operator, assistant, and ultrasound device. Here the patient, here operator, assistant, and ultrasound. Like this. The assistant holds the probe, and I use a guide wire and balloon. Nowadays, I hold the probe and guide wire. Then the assistant hold the end of the balloon catheter. The series of ultrasound-guided PTA. Before PTA, we check the stenosis. Here stenosis, then here a stenotic site, long segment stenotic site here. After insertion of the cis introducer, we pass the guide wire like this, and the guide wire go through passing of guide wire technique. Sometimes the venous valve, it is difficult to pass the guide wire through the valve. Then it is easy to guide wire passage using ultrasound. This is an aneurysm. Then it sometimes is difficult to pass through the aneurysm, but we can see the vessel, so it is easy to pass the guide wire. Sometimes
Currently, we're on the video, but unfortunately, the sound of the video was not available right now. So we can just sit back and relax, enjoy the video.
The guide flips and passes through the osmosis. If the osmotic angle is steep like this, it is difficult to guide the wire into the proximal side of the radial artery. Then we do like this, then go past the guide wire into the proximal of the radial artery. The stent implantation. We do the stent implantation using under the ultrasound. Assistant hold the probe. Don't move. Don't move. Then I implant the stent like this. It is a proper side of the stent. Techniques for local anesthesia. Nowadays, we do the anesthesia in the rear side of the vein. This is a guide wire. Then in the front of the vessel. So the total around vessel, around the vessels. It's a long needle, and then this is anesthesia rear of the vein and in front of the vein. Vessel rupture. Sometimes vessel rupture this is a rupture point. Then after we can see the deflation of the balloon, the rupture point, then we immediately balloon inflation and stop the rupture. And after rupture, we inflate the balloon like this. But sometimes the point is not a good point of the balloon, so that we can see the rupture point. Then move the balloon at the proper side, and then there are no rupture here. Pre-PTA, post-PTA, this case is a very long segment of stenosis here and stenosis here. The all stenotic region dilated after PTA. Outflow vein of the graft is a long segment of the stenotic side. Outflow of the graft. This is a pre-PTA, and this is after PTA. There are the almost all side of the stenotic side dilated. In stent stenosis, we can see the stent stenosis like this. After PTA, there are no stenotic side. Chronic total obstruction case. This is obstruction here. Then the shunt flow goes to the collateral vein. So in this CTO case, the ultrasound-guided PTA is very effective. We can see the vessel like this. So we check the guide wire into the true lumen of the vessel. Then we dilate the balloon like this. So it's very easy. So the advantage of ultrasound-guided PTA, we can observe changes in inside outside blood vessels. Confirm that the guide wire pass through the true lumen. Bleeding from ruptured blood vessels can be confirmed in real time. Disadvantage of ultrasound-guided PTA, difficult to grasp the whole picture of the vein. We can perform for central venous stenosis. It is difficult to visualize inside blood vessels in thoracic grafts or calcified regions. Thank you.